talking about burst pipes.
Yes.
These are water, if a pipe bursts, this water runs in on the ground. And from the health perspective, even if you come for inspection in an abattoir, whenever a carcass is falling down the ground there, it means it's totally condemned. So when it comes to water, as it is and its sensitivity, it is very much important to mention that we cannot, I would not rather also encourage people to test water that from a burst pipe. Meaning that you are certifying the nation that, guys, if you see water that is running in the stream from a burst pipe, it's actually good and conducive for you to take this water for consumption or whatever uses. Let me just bring it close to you that within these informal settlements that we have, the city of Windhoek, with the outbreak of hepatitis E, has done tremendous efforts to make sure that water provision is being made available to all these, or to most of these informal settlements. And I can also clearly remember that we were busy with a 7-kilometer water pipeline. And as such, not that there was no pipeline, but it was extended further. And with the different terrains, as you know, there are different areas that are existing there. And it makes it also difficult for the provision of these services. So 7 kilometer, there was stretch within Havana, within Koreankap, and the surrounding informal settlements. And as such, I can also just mention to you that there were also water tanks that was provided provisionally to make sure, just that was before the erection of these water pipes. Just to make sure that the people that are in these areas do not get attracted to the water that is in the streams, that is running there, so that they can actually complement and supplement that particular usage with the water that is potable and clean. And these steps, all these steps, as much as they are tested in Hochland Park, the same test is being done right down in the informal settlement of Havana. So that is a direct reading test, and we have an analytical lab, our scientific services that does test every day at all different types of water discharging facilities. So these are consumable water that are in the community, and they are actually safe for water, for human consumption. But we don't find water that is running, whether it is in town or whether it is Havana. Water that is running in a stream is not fit for human consumption.
So burst water, regardless of geographical positioning where you find it, definitely a no-go. Water is life. Diseases affect all of us. It is a national conversation, and thus we welcome you to give your input through our call line. The number is 061, that's the area code. The number itself is 400397. 400397, that's the call-in line. You can also communicate with us on our social media platforms. On Facebook, you can find us at Ministry of Information and Communication Technology, Republic of Namibia, Ministry of Information and Communication Technology, Republic of Namibia. That's on Facebook. We also have our YouTube channel from which we are also streaming live. That is MICT Namibia. MICT Namibia. That's our YouTube channel handle. So please do join the conversation. We would love to hear from you. You can also pose questions to our panelists. Now, Mr. Nambahu, Mr. Kahimise looked at certain steps and measures that were taken by the city, especially after the outbreak of hepatitis E in the city. Now, from a national geographic perspective, what has the Ministry of Health tried to do? What is it doing? What is its future plans, if there are any, to try and mitigate the risks of waterborne diseases?
Well,
But before you continue with that, pardon me, let us just welcome a caller that we have on the line. We've got Mr. Anytime from Tsumeb. Good afternoon, Mr. Anytime. How are you this afternoon?
I'm good, and how is Madam? Okay.
We are well.
Is it Kaiwa?
Kahiha.
Kahiha.
Yes.
I'm sorry, Madam Kai. I'm sorry for that.
That's fine. We are well. How are you, sir?
I'm well too, thank you.
Good.
to the panelists also. Good afternoon to you all. Maybe if I may divert the focal point from the urban setup to the interior rural areas. When I just came across the topic on the screen, my mind just only looked into the rural areas.
Yeah.
I'm putting it into a presumptory and imaginary perspective. But whereas it is the reality. In most cases, in the rural areas, they draw the water, rainwater from the swamps, from the ponds, from the wells, right? But now, let's look at when nature calls. Let's take into perspective, are there latrines where people relieve themselves at the toilets? Most of them, no. Now, in such a context, when the rain rains, this rainwater flows down into the swamps, into the ponds, and into the wells. Now, how much awareness has been given to the communities to be aware of these water-borne diseases in that perspective?
Okay.
Maybe the awareness is not that much.
Yeah.
Yes, maybe we need to also ponder on that one. Thank you very much.
Thank you very much, Mr. Anytime. And that definitely does tie into the question that we just posed to our representative from the Ministry of Health, Mr. Nambahu. I think that falls right in to what we just asked before Anytime gave us a call. So what would that response be?
As far as because with the ministry, or should I say from the ministerial perspective, we have different divisions that deals with different stages of diseases. Like
Yes.
from the preventative perspective, we have environmental health practitioners divisions that goes out in the community, just try to create awareness, and that way, what we have been doing ever since the outburst of this outbreak for hepatitis E. Apart from and with now awareness we create in terms of how should they keep the environment clean, and of course just to try to other methods that they may put into consideration, obviously local affordable methods that they may use to treat their water. Like one of them is boiling water, of course. And that is one of the best methods, especially in rural areas. Before you try to drink or use water for some other reasons, maybe like to cook food, wash your fruits and veg. So it's always better or best to ensure that the water is boiled, just to kill all the pathogenic microorganisms that may be present as well. And another method that we had is we had water purification tablets as well.
Yes.
Because throughout our campaigns, because personally I've been one of also of the person engaged in the program as well.
Yeah.
So we've been going throughout the community, so supplying them with water purification tablets and just to purify the water before using them for domestic purposes. Yes.
Okay. But I think the question is campaigns. How and what type of campaigns have you put out there? Have you had any challenges trying to reach these people? What type of challenges have you had? And the distribution of these tablets, how far has it gone?
Well, with regard to the campaigns that we had, because I'm pretty sure Mr. Kahamisa was also part of the CLTS program that we had. Because it's more like of just showing the community on how they should build their toilet facilities with local available materials as well. Okay. And there are several models that have been built where the people, the community may copy and of course come up with their own. And of course by this, I'm pretty sure also that back then City of Windhoek didn't approve some sort of toilet, speaking under correction, Mr. Kahamisa. And then coming up with such models, that's when now people started coming up or building their own toilets using local available materials as well. And with the campaigns, as far as I can't really talk, from the perspective of other regions as well. But I was just more focusing on Windhoek because I was personally part of the program that has been ongoing.
Yeah.
Yes, because I'm pretty sure like we have been doing this ever since the outburst of this outbreak, and like monthly, maybe 5 times a month, we used to be there present just to create awareness, giving posters and leaflets in all local languages as well. Just and some programs have been held at the radios as well, just to create more awareness as well. Yes.
Okay, okay. Ms. Shanika, COVID-19 is an airborne disease. Not even to some extent. It's very much an airborne disease. It's dispersed through droplets. It has a very, I would call it a long life, shelf life, if I can call it that, when it drops on surfaces and so on. What are some of the successful interventions from your efforts in your district work? Can you give us, and COVID-19 that have been replicated by others?
Okay, thank you, ma'am, for the question. The intervention was put it in place, wearing of mask. If you wear your mask, even if you cough or you sneeze, you won't release or discharge the droplets, so it can you can also infect your neighbor or the person who is close to you. The other one is social distance, at least 1 meter from each other. Even if one sneeze or cough, then he or she will not infect the others. And also the isolation. When one is affected with COVID-19, then she or he have to be in isolation for her or him not to spread the disease. And also quarantine.
Yeah.
If you realize that or you suspect that you have COVID symptoms, then you have to go to quarantine yourself, and you should also go for test. But when you are going for test, you should wear your mask, and you should also wash your hand and sanitize.
Okay. Mr. Kahim, you want to add on to this?
Maybe also just adding to another point, very important one,
yes.
as far as the COVID-19 is concerned, because we have what you call contact tracing as well. Me being also the one of the regional contact tracing team lead.
Yes.
And I'm pretty sure that this kind of initiative has been rolled out to all the regions. Each and every individual region has their own contact tracing team in place.
Yes.
So whenever we have a positive confirmed case, we have a team that traces the high-risk contacts just to ensure that at least these people are contained and they do not continue spreading the disease as well. So it has been really quite
effective.
Effective, yes.
Okay. Okay. So, but what are the challenges with that you found yourself dealing with, especially in the remote areas?
Yes. Basically, from that perspective, is that normally it's hard sometimes to reach out to those people and ensure that they are tested on time. Yes. And the other thing is that also during the maybe resurgence of cases where we have a lot of cases like being reported per day, so it has been also much exhausting sometimes.
Okay.
Yes.
Okay. Mr. Kahimi said we looked at improper relief, if I could put it that way, defecation and so on, being some of the, some of the challenges that create or host these waterborne diseases and so on. We also looked at the fact that these diseases are prone in areas that are informal, like your informal settlements, of course, that are not part of the formal structures that had been planned for by the city. Over the years, we are aware of the fact that the city has done a lot with regards to efforts of putting up facilities to have people use those rather than going out into the field. Now, we would like to know, have those efforts been effective? with all honesty, with regards to the structures that you've put up, and are they conducive enough? What have the challenges that the community's been bringing to you with regards to these setups that you've put up?
Very important question. And I would rather also reiterate that it is very important for us to look at these particular facilities that the city is putting in place. One of the perceptions that our people have is that whenever you come and put up a facility, they would look at you and say, oh, this is municipality, so it belongs to Muni. And as such, rightly said, the city has done really, really tremendous, over millions. And I have a small report here that was just in the first half of the year that the outbreak was, and the money that was spent there over only on facilities. And that is, it means that reparations of the existing facilities and also adding those new facilities that the city is looking for to cover or to have the people covered in that area with facilities that are good for sanitation. What I can tell you is that our community has a serious problem in terms of taking care of facilities that deemed to be from a certain organization. We know that we have an embassy of China that also donated 20 toilets, and different other organizations that came up with interventions that just to increase these facilities within our informal settlement. But the problem is the ownership, taking of ownership. And I can tell you within the first 3-4 months of the reparations, about 50% of the toilets that was repaired was already being demolished. So meaning that if we, for an example, have been repairing the total cost, I mean the total number of toilets, maybe 300 of them, 150 was repaired. But half of the 150, within the first 3 months, while the process of reparation is still going on, the community already started stealing the toilet pots, the cisterns, and damaging even the pipes and bypassing water and all these type of things. So these are efforts that are good and that are aimed at improving the lifestyle of these people that are deemed to be within the informal settlement. But our own people would destroy their own property, deeming and believing that it belongs to the city. It belongs to somebody else. And that is the paradigm shift that we need to create as environmental health practitioners. And I'm very happy that the panel of today is strictly environmental health practitioners. And these are the people that are within the forefront of health promotion, creating a different paradigm shift or creating a new paradigm within the thinking of our own people. Health education, when we started with HIV and AIDS, condom was something that we should not talk about. It was a real taboo. Today, you cannot drive with a truck. Then the people are flocking into the truck. So what was it? It's creating the paradigm to teach our own people, to let them understand that these facilities that is here is for ourselves. And if it is broken, it's not the city that will get sick of hepatitis or typhoid fever or whatsoever. It's ourselves. So these are the interventions that we are actually doing on a daily basis, and we are employed to go and do health promotion. That's why we have even the health hygiene month. In the month of September, the whole month, we do just hand hygiene. And this is not an intervention that came during the time of hepatitis E. No, it was there before, because we knew the importance of just washing your hands. Our people are lazy to wash hands. And hence, we are eating feces. And you just rightly talked about open defecation. Open defecation, currently the UNICEF has come along, like Mr. Namba just rightly mentioned, that we are busy with the CLTS, which means it stands for community-led total sanitation. These are things that the community has to take ownership of. And it is part of these interventions that we are bringing forth to try and bring Namibia to a notion that we call ODF, open defecation free. So that means that we are going to curb all the viruses that are coming from fecal oral routes.
Just to follow up on that response, you mentioned how sometimes, you know, you are, as the city trying to assist, trying to provide, you are met with challenges, like the vandalization, the stripping of those facilities. What are some of the measures that you've been able to put in place to try and mitigate this problem, besides the whole creating of awareness and striving for paradigm shifts? What are the, if for lack of a better word, possible legal mitigation efforts?
Were they legal?
No, legal. For example, police or
Yes.
locking up yes. Legally, are there any possible efforts that you've been able to put in place to try and mitigate, the vandalization, the stripping of these bathrooms that you set up? Because as you said, even halfway through the process of rehabilitating a facility or the number of facilities that you have, halfway through, half of these things are already vandalized.
No, definitely. So thank you very much for that. Definitely, whenever you encounter a problem, whether it's behavioral or whatsoever, or which hinders the progress, or whatever the measures that you want to put in place, you look into measures as to how can we address this. And definitely, as we know that we have City of Windhoek, which is our legal department. Whenever we do all these things, even as going just outside there, all our different departments are involved, be it health infrastructure, be it scientific services, or our legal department, which is now the City of Windhoek.
Yeah.
And yes, before we bring things and property to the community, it is within the right setup. Even when you go to the rural areas, you go through the gatekeepers. Who are the gatekeepers? These are your local councillors. You must also know and understand that apart from the city councillors that we know about, that we are elected for, there are those community councillors that we call their informal councillors. Those are the people that are the voices. They are the voices of the people out there, the Kapuas and the others, when you talk of saving the land and so on.
Yeah.
So whenever you come with a project or a program within these communities, as much as you recognize your legal setup, which is there, you also go through these structures that are there.
Yeah.
And as such, these are the people that basically also help us with creating the paradigm shift, and also that are also doing their own policing in terms of making sure that whatever is being put there, the people understand that it is for our own
Yeah.
benefit.
Yeah.
And as such, it is true that there is so much that is being done by the city from the legal part to make sure that, and it is, and I can actually confirm that the efforts that has been done has done a lot of change. We are talking about, I've read in the newspaper that we kicked out hepatitis E out of Namibia. And as such, as we are speaking now, it is true that hepatitis E had dropped minimally.
Yeah.
And today, we can also say that COVID-19 has helped us to also kick out hepatitis E, because it's the same practice that is being required.
Okay. It's actually very good news to be hearing such, where you see a light at the end of the tunnel. And I think the whole fight against hepatitis E somehow became gloomed after COVID hit. It was silenced a bit. And what I found ironic was that if we look at the symptoms or should we call prevention measures
The roots
for
of infection.
hepatitis E, if we look at the ways in which, hepatitis E is contracted in comparison to COVID, the prevention measures were actually quite similar, if they're not exactly the same. So there's kind of a silver lining from when I read that report in the newspaper. It's that whole thing of COVID came along, and somehow now we have gotten rid of, if I could call it that, of hepatitis E, which was quite prevalent.
Yes.
It was quite scary also, because it was one of those invincible enemies that, one would wonder, how can we really get rid of this under, the conditions and economical conditions also that we find ourselves? So it's that silver lining there. Ms. Shanika, we're moving now from, for example, the comparison between COVID, hepatitis E, so on. Can one then also state that other illnesses such as your flus and so on, are they also considered to be airborne diseases?
Thank you for the question. Yes, but I'm talking under correction, but I think flu is also airborne because you can only contract that virus when someone who is having flu, sneeze or cough,
Okay.
and then discharge droplets.
Yeah.
Yes.
Okay. And also, when is the best time? The weather is changing. I'm sure many of us have kind of picked that up. It's becoming cooler. And if there is any best time to try and educate people with regards to the winters and what to do and how to assist themselves, I would want to find out from any of you, when would be the best time for somebody to go for, let's say, a flu shot? Because we're taking into consideration now that a lot of flu symptoms are similar to a lot of COVID symptoms. And I think that is one of the greatest problems that we've had in the past 2 years, that, many of us sit back and we think we only have a flu while we actually have COVID. So maybe a flu shot would be one of those that would mitigate flu symptoms so that you don't sit too long while you have COVID thinking you have got flu. So when would be the best time for somebody to have a flu shot, and who is actually eligible? Is there a particular age cutoff?
Okay. Well, with regard to that question, it's quite a good question, though. We're looking at flu. As she said, it can also be an airborne.
Yes.
So when someone coughs, or maybe the person is talking or they sneeze,
Yes.
and of course if they're infected, these droplets will end up suspended in the air.
Yes.
And of course, if you are near or next to them, you end up inhaling them. Or otherwise, we can also contaminate the surfaces like doorknobs and stuff when you're touching your nose and you're infected, and someone touches them and later on touches their nose, so they can
Yeah.
also contract it that way. With regard to when is the best time to get their shots? With that, I can say anytime is the best time, but with regard to some trusted sources,
Yeah.
with regard to some trusted sources, is according to CDC,
Yeah.
they say around about September, or at least at the end of October, everyone should get their shots.
The flu
Yeah,
shots.
because around about like February then the thing is picking up.
Oh, okay,
Yeah.
okay. So it's like it's a early prevention.
Yeah, yeah.
It sounds crazy. September,
Yeah.
October, you're thinking, but winter
Yeah.
is so far away.
Yeah.
So,
So like for this year, you could have gotten your thing already last year in October,
okay.
September. There.
But
So,
why such a big gap
um,
between when you receive the shot and when the season actually is on its onset?
with that, I think it's regard to with regard to just prepare your body as early as possible, just to fight or to develop more antibodies for the in case you happen to get
Yeah.
infected as well.
Yeah.
Yeah, and with the who is eligible to get these shots, as far as I'm aware, is that as young as 6 months of age,
Okay.
you can already start getting your shots.
Okay.
And also looking at some people at high risk of contracting the flu, like these are people with comorbidities,
Yeah.
like asthma,
Yeah.
diabetes,
Yeah.
heart problems, or chronic diseases.
Yeah. Okay.
These people should get their shots as well.
Okay.
But also in exclusion with people, or should I say, while we are also on that point, it's important to see who might consider not getting it, because we have people with severe life-threatening allergies.
Yeah.
If you have previous history to reaction, like you reacted badly to one of the shot, like to influenza shot that you got, you have such history, then you might not consider yourself getting it. Maybe you
Okay.
consult your doctor to
Yeah.
see some other measures on how
Yeah.
to keep you on the safe side as well.
Okay.
Um,
Okay. Well, I think what we take away from the discussion this afternoon, it's hygiene. Hygiene. Risky activities with regards to where you get your water from. I think that is also something we can take away from this discussion. The fact that we should try by all means to make sure that we source our water from formal setups that has water that has been treated to ensure that that water is safe for human consumption, setups that are maintained regularly by the various institutions that are responsible for the maintenance of these facilities. I think the other aspect that has also been brought to light is the fact that ownership does not belong to the institution that sets up these various facilities. As much as the maintenance may depend on them, we all need to play our part in taking care of the infrastructure to ensure that it lasts us a long time, and it also assists to ensure our health. Awareness, I think it's also a national message that we can carry for those who do know the information and have it, finding themselves in environments and areas where others do not know. It is very important for us to teach each other as a nation. I think a national approach to try and eradicate some of these problems is one of the best approaches to mitigate the problem. And I think also with regards to things like COVID, it's a good example. The eradication or the near eradication of hepatitis E, I'm sure it took really a national effort to try and get us to where we are today in comparison to where we were 3 years ago. So I would like to thank our panelists for taking the time out to come and give us this very important information. I would like to thank you, our viewer, for tuning in to make sure that you learn and, be able to enrich yourself with information so that you can educate others where necessary. From myself, Shianwa Desire Kahiha, along with my production crew, we say thank you very much and have a good afternoon further.